Oman is hosting this important meeting in Maris because of the role of Oman in integrated surveillance regarding to acute respiratory infections and being classified as one of the top countries in the region in event-based surveillance. Imaris will support Sultanate of Oman in further strengthening surveillance and supporting WHO Collaborating Center for Emerging and Re-emerging Infections to assist other member states in the prevention and control of acute respiratory infections.
Acute respiratory infection is the leading killer disease in Somalia as well as in the rest of the world. What we have done while responding the COVID-19 response is to scale up the availability of high-grade medical oxygen, especially in the peripheral locations where children and mothers do not have access to care. What we have achieved and learned over the years is that 95% of the children and mothers who were seeking healthcare in those facilities where we have set up the solar-powered medical oxygen concentrators have survived. This means that this is possible even in fragile settings to use innovation, to use science and evidence to make sure that children, women, and other vulnerable population have access to care and their lives can be saved.
Let me bring up the experience of COVID-19 vaccination in Pakistan. And it was started with bilateral negotiations with different manufacturers, and then of course supported by COVAX platform to supply of vaccines. But within the country, the infrastructure was such, which was developed during a routine immunization drive. Vaccination coverage has gone up within very short period of time, reaching more than 50%. And today, if you look at the target population, more than 80% of the target population is covered in Pakistan, especially people above 60 years and also people who have comorbidities.
Great conference with a lot of good presentations and ideas on how to tackle future respiratory diseases and pandemics in the region. Serving now in Saudi Arabia and also prior to that was serving in other countries, I think I can take home some of those recommendations and try to implement them to make an impact on the ground. A clear example for that is the recommendations to have health security plans together with the health system preparedness plans in a weaved manner that would force our future response to any future respiratory diseases or pandemics through the 10 pillars identified by WHO as a response.
Trying to actually bring the experiences that we have from country level from Iraq, where in the past we had our surveillance picking up cases of influenza, able to determine the H, but we were not able to determine the N back then. And we learned our lesson when we increased our capacity using science to drive decision making. We increased our capacity in the laboratory, and we are still looking forward to further increase that capacity so we could keep our country safe, keep the region safe, save the vulnerable, and promote health.